you're on a gluten-free diet and you're still having issues, we want to find the root cause. We want deeper. We want to get more data. And so the Dutch test is really the best way for us to get a good picture of their stress response from cortisol as well as their hormone needs.
Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jaclyn Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Hello, and welcome to this week's episode of the Dutch Podcast. Today we're going to talk about celiac disease and all of the different aspects of managing celiac disease. My guest has celiac herself and also is a dietitian and nutritionist who works with celiac patients. And really what I learned in this conversation is that, of course, we're going to talk about nutrient restoration and about gut health and how to improve gut health with gluten avoidance and other support. But there's so much complexity when patients have celiac disease because there's all this added stress around eating. There can be effects on your mood, your ability to engage in your social life, that it becomes really complex. So if you look at it only from a nutritional angle or a gut healing angle, you're really missing a huge part of the story, including things like cortisol and HPA axis dysregulation, which is really where the Dutch test comes in. My guest is Erin Kenny. She's a registered dietitian nutritionist and the CEO and founder of the Celiac Space, which is a specialized nutrition practice dedicated to helping people with celiac disease reclaim their health overall. Like I said, she has celiac herself, and Erin brings this personal and professional expertise into her work. She's spent years translating the science of celiac disease into practical, sustainable guidance for her clients. At the Celiac Space, she leads a team of registered dietitians who are all focused on helping people navigate just the complexity of celiac management, starting with the nutrient rehabilitation and gut healing, but also the emotional and neurological dimensions of living with this chronic autoimmune condition. I think you're going to really love this conversation. Let's go ahead and welcome our guest. So, Erin, I'm so happy to have you on the pod today. Thank you so much for joining me.
Thanks for having me.
Well, I want to start out because, you've become a celiac specialist, but this comes from your own personal experience of having celiac yourself. Tell me a little bit about how your own diagnosis has shaped the way that you care for patients.
Yeah, great question. So I was actually diagnosed with celiac in high school long before my experience into the medical space really began. And so when I actually started becoming a dietitian, I really wanted to focus on sports nutrition and kind of optimizing people and their health. And as I got into it, I did work in the sports nutrition space for a while. But I kind of stumbled upon people with celiac disease like myself who really struggled. And I realized that there was such a big community of people that just didn't have the support and resources. There's so many myths online that are bananas, to be honest. Like reading them back then when I started the celiac space was shocking to see how little support people had. And so I knew that I was in the unique seat of somebody that had the medical education, that had lived with celiac disease to really support these people. And so that kind of began my journey into the celiac space of providing, support and education and resources to this community.
You got to share what some of these craziest myths were that you came across.
Oh my gosh. Can I eat, or if my house is getting remodeled and they're redoing the drywall, will I get sick? Like, is there gluten in drywall? Does my tampons have to be gluten-free? I don't know. I mean, I saw people, probably like one of the most common ones is when people are newly diagnosed, they are told, oftentimes by their doctors, that they have to buy all new kitchen equipment, all new pots, pans, thousands and thousands of dollars of supplies. And so a lot of times people do that, which is fine, but it isn't necessary.
You also could wash it really
Yeah,
thoroughly.
you could wash it. Exactly.
Yeah.
And so there's just such lack of information around that.
Absolutely. I have celiac as well. So this
Yeah.
is going to be a really great conversation. I'm like totally thrilled to dive in with you. We can talk more about that if you want to. But before we get into the nitty gritty, I want you to start really at the beginning for our listeners, providers, and patients. What is the difference between celiac disease and gluten sensitivity or intolerance? And why do we have to care about that distinction? Let's just kind of lay it out. What's the difference?
Yeah. So, celiac disease is an autoimmune disease. We can test for it. There are specific endoscopy procedures and lab work that can be done to diagnose somebody with celiac disease because somebody with celiac disease has an autoimmune reaction, which we can test for the antibodies. And so, if you are somebody with celiac disease, eating even a small amount of gluten causes an autoimmune response, which causes damage to the small intestine. And the small intestine is where we absorb so many nutrients. And so having damage to the small intestine causes nutrient deficiencies, which then cause a lot of downstream issues.
Mm.
So definitely a big deal and really important for somebody with celiac to follow a strict gluten-free lifelong diet. Whereas somebody with gluten intolerance, that can be more symptomatic of something more underlying, right? So it's something that might be resolved with treating the gut properly and addressing their health. In some cases, the symptoms might look the same for somebody with celiac and someone with gluten intolerance, but the mechanism and the severity of health risks and damage are significantly different.
That's really important to point out. It's like the long-term sequelae. I actually had this come up because I got a workup. It's been a long time since my biopsy, and I had a workup at a new hospital, and they
Yeah.
were like, "You don't have any nutritional deficiencies. This is pretty amazing. Let's, maybe you don't actually have celiac. Let's do another
Mm.
biopsy." And I did, but I eat well, right? I'm sure you
Yeah.
do too. But my son was like, "Well, why would you even do a biopsy? Like, you feel better off it. Stop. Just don't eat it again." And it's like, well, part of it is, do you really have to? Really, really have to? Or
Yeah.
is it a preference and you can, eat baguettes in Paris and not have to worry about it?
Yeah. And there's so much misdiagnosis, right? Like the
Hmm.
diagnosis for celiac is really complicated from the endoscopy to the blood work to genetics. And so it isn't always cut and dry. And there are some instances where people need to go back for a second endoscopy to either check healing or to confirm diagnosis, that type of thing.
Right. Yeah, absolutely. So when a client first comes to you and they're newly diagnosed, of course, they're in a complete state of overwhelm.
Yeah.
Hopefully less today because I think gluten-free diets are just more prevalent and it's a
Yeah.
lot easier to be gluten-free. But what is the first thing that you want people to understand about what's actually happening within their body?
I think what I want people to understand at first is the beginning is the hardest and it gets easier. It's never easy. And I think initially that overwhelm is really challenging for people and the stress that it can cause, partially from the misinformation, like I said, partially from it uproots a lot of your life, right? A lot of people think
Mm.
like just go gluten free, but it impacts, as you know, your social life, how you talk with friends and family, how you navigate your own home, the products that you use to eat. And so it really changes everything. And so I want clients to know that the beginning is the hardest part. It won't always be that way. It won't always be easy. We all still have difficult days. But I think that's important because the increased stress and anxiety can cause a lot of health issues on their own. And then also explaining to clients from a physical standpoint that their body is in a healing phase, right? That their gut is damaged, that they are at risk for nutrient deficiencies if they don't already have them. And so being kind to their body, providing nourishing foods, supporting it, doing additional lab work is really important.
Yeah, when you talk about the social impact, I mean, I think that's an understated part
Yeah.
of the diagnosis. Like, I remember talking with a patient that she was like, "Oh, I like brought protein bars to a wedding and like ate them in the bathroom because I didn't want to be rude and tell the host that I had to have a special diet." And it's like things like that are the ways that this intersects with your life in a way that causes tremendous stress.
Yeah.
You have to always kind of be prepared,
Mhm.
or you only imagine the first time you bring it up with a new friend, or
Yeah.
you don't. No one wants to be a pain in the butt with how they eat.
Yeah. And a lot of times people are diagnosed midlife, right? Like they lived a life without celiac disease. And so you get diagnosed and it's a quick about face. And so it's difficult for the individual with celiac to come to terms with that, but also for the other people in their lives that they maybe
Mm.
went out to dinner and had pasta with them the night before. And so now you're telling me I have to be gluten free, I can't touch it, I can't look at it, I can't breathe it. It's really confusing.
Yeah, it is confusing. I mean, I think it's a lot. It's just a lot to take in. You wouldn't think about just avoiding food being so difficult, but because it's so prevalent,
Yeah.
it really can be. I
Yeah.
want to talk a little bit about celiac because it's not just a gut disorder as well. We know that people with celiac disease have a wide range of other symptoms, brain fog, depression, anxiety, fatigue. I actually have had diagnosed patients who came in for infertility and we discovered
Mhm.
celiac on the workup, or menstrual irregularity. So for many patients, the burden is far beyond just like it hurts my stomach or it hurts my gut when I eat. So we talk a lot about this gut brain axis, But what does it actually mean in context of celiac disease specifically? And like, why is that something that's just, it's very real in celiac disease?
Yeah, so with celiac, we know clinically there's over 200 symptoms of celiac disease. And so classic quote unquote textbook, which is definitely outdated, is, diarrhea, vomiting, poor growth, sometimes constipation. But we know that it can look so different for so many people. And a lot of times people are asymptomatic completely.
Mm.
And so what's important for people with celiac disease, getting to kind of the gut brain axis. So the biodirectional component from our brain to our gut. In people with celiac disease, a kind of an example that I tell a lot of my clients is the gut brain axis works both ways. So from the brain to the gut, if you're thinking, does my stomach hurt? Does my stomach hurt? Did that food have gluten? Did it hurt my stomach? If you're thinking about that so often, you're going to get a stomach ache, right? Or you're going to have some symptoms. Same thing in the opposite way, right? A lot of, our healthy neurotransmitters and, like metabolic products are produced in our gut that then go to our brain and can cause things like you mentioned, depression, mood disorders, sleep disorders. And so in people with celiac disease, when the gut is damaged, that can definitely cause more cognitive issues. Oftentimes we see brain fog and fatigue. And I will say it isn't only because of celiac disease. There's obviously a million other components. And so I'm always hesitant for people with celiac disease to say, I have fatigue because I have celiac, right? Well, did we look at other things? Did we look at your
Mm.
diet? Did we look at blood sugars? Did we look at your hormones? I hate for somebody to maybe hear what I just said of the gut brain connection with celiac, because that is important in terms of inflammation in the gut and how it impacts the brain. But that isn't the only thing that could be causing it.
I love that you bring that up because it's like you could have celiac disease and
And
fill in
yeah,
the blank. That's such a common kind of assumption that we make is that, oh, everything must be related. I love that you're reminding us to go through the full workup.
yeah,
I talk about this with perimenopause sometimes. It's like if you have fatigue in perimenopause, it could be related to hormone change, but it could be hypothyroidism, or it
yeah,
could be an autoimmune disorder, or it could be a Epstein-Barr virus. I mean, it could be a million other things. So let's not
yeah,
forget to put
yeah,
our clinician hats on and really dig in.
yeah.
So, I mean, I'm sure that you work with people right away when they come in. They may be highly symptomatic. What's the time frame around like when you see these symptoms typically improve with a gluten-free diet?
Yeah, it's very different for each person. I would say so in our practice, we work with both pediatrics and adults. Pediatrics typically improve much faster. I worked with one this morning, and at diagnosis, her labs were off the charts, so over 250, which is pretty classic. We don't know if that's 251 or if that's 500 and more.
Hmm.
But within 6 months, she was back into a pretty standard range of 15, which is incredible. Most adults, that would take longer. So it really depends on so many factors. It depends on the person's health in general, right? Age, we have noticed a difference. Pediatrics definitely heal and labs improve much faster than adults. What their diet looks like, what they're doing to reduce inflammation, what they're doing to address nutrient deficiencies. And some of it's out of our control in terms of just your body's turnover time for healing. But I tell clients, in terms of symptoms specifically, we should see an improvement in your symptoms in 3 months, 6 months in severe cases. But if we aren't seeing improvement in symptoms and at least improvement in labs coming down, working in the right direction, we need to dive deeper. And we do that twofold. We look at the gluten-free diet. Let's dot our I's. Let's cross our T's. Let's make sure you truly are gluten-free. You're not doing anything that could get you cross contact or that's gluten sneaking in your diet. And let's look at what else it is that could be causing symptoms. Because maybe your gluten free diet is working, your gut is healing, but you're still fatigued because you're
Hmm.
not managing blood sugars. And you're eating a lot of great gluten-free foods, but you're not eating enough protein, and you're getting a lot of processed foods, and so that's causing fatigue and dysregulation there.
You bring up, I mean, there's like a couple of great points I want to talk about. I think the first one is like that commentary of you're eating a lot of processed foods because I have noticed myself and with patients, one, when you get diagnosed with celiac, every kind person in the universe brings you like gluten-free cupcakes and brownies, right? Like, but I think oftentimes you start to buy the packaged, prepared gluten-free foods because you know they're gluten-free rather than
Mhm.
relying on more of a whole foods diet.
Yeah.
And it's such a natural thing to do, but oftentimes those foods are nutritionally empty, even more so than their gluten containing counterparts, which might have whole grain wheat in them or something like that. You're looking at like rice crackers or tapioca flour, potato starches. Can you talk a little bit about that, and that, like, how do you help people through that? Because it's such a hard shift, but then you have these high glycemic, low nutrient foods that people are turning to. You must face this all the time.
All the time. Yeah, it's difficult. And I see it a lot when people are newly diagnosed. Like you said, you're newly diagnosed with celiac. Everyone wants you to try the newest gluten-free cookie and cracker and, make gluten-free food for you. And when you go to the store, it's exciting because you just opened up a world of all new products. And maybe you're not familiar with Trader Joe's and you get to go to Trader Joe's and have all their great gluten-free products, which is understandable, right? I get from as somebody with celiac, you're already so restricted. There's so often everything is no, no, no. So when you get to say yes to a cupcake, obviously that's something that is going to be really tempting. But what's important is to make sure that the majority of your diet is still a whole food diet, right? And oftentimes with people with celiac disease, they might have a really great diet and then they transition to a gluten-free diet and go to all processed foods. One, because they don't have the right education and support to know how to read a label and determine what canned beans are gluten-free. And so they say, I'll just have only canned pasta instead, right? Or they don't have the confidence to get a gluten-free rice product maybe, and so they're just gonna do gluten-free bread. And those packaged foods are fine every now and then, but when that becomes the bulk of your diet, that's when we have concerns, right? In terms of inflammation, in terms of glycemic load, in terms of lack of nutrients, because most gluten-free products aren't fortified, like their counterparts. So there's a lot to it in terms of when we say a gluten-free diet, it can look very different. It can be a gluten-free whole food diet or a gluten-free processed food diet. And while having a gluten-free diet for somebody with celiac is the most important thing, right? And, not eating wheat and those type of things, the quality of it is very quick second importance.
Do you have any quick hitting suggestions of, like, these are some of the top nutrient dense gluten-free foods I steer my clients to?
Yeah, I really say whole foods. I mean, you still should be eating fruits and vegetables and meats and potatoes and rice. Like, the basic things that don't have a gluten-free label, that are only a few ingredients. And I think a lot of people get concerned because even something like a can of beans might not say gluten-free. But if the ingredients are just baked beans, water, and salt, that's a great food product, right? And so having my role and something I take really seriously is supporting the education to people so that they can pick up any product. They don't need to rely on a food scanner or, Googling everything to determine, is this safe or not? Because most whole foods don't have a gluten-free label. You're not going to pick up a water bottle that says gluten-free.
The other thing that you'd mentioned is around, like, the time it can take to heal.
Yeah.
And also contamination. And I'm curious about your experience where, have you found that some people, they are less reactive to contamination, where other people, like, they even need their own toaster in their house because, like, the crumbs from the gluten toast will get on theirs and they'll get sick from it. Like, from a lab perspective or a clinical perspective, is there variability in that reactivity?
Good question. So a few points. Yes, there is variability in the reactivity or the symptoms that someone would experience, but that doesn't relate to the amount of damage, right? So there's some misinformation, I'm going to say, online that says people have different severities of celiac disease, which isn't the case, right? You're either pregnant or you're not pregnant. You have celiac or you don't have celiac disease, right? You might have
You can't be half pregnant and you can't
be half pregnant. No, you might have a tougher pregnancy. You
I'm
might
just
have
a
more
little
symptoms.
pregnant.
Just a little bit.
I'm not pregnant, by the way. Let's not let that get out.
Yeah.
That's not out of the
bag. And so that is kind of the misnomer around your symptoms equate to how strict you need to be or how much damage it's causing. So symptoms don't necessarily matter in terms of strictness. Everybody, whether you have symptoms or not, need to follow a strict gluten-free diet. There's actually some research on the toaster in kind of comment that there is some good research that shows that even sharing a toaster can cause enough cross contact to expose somebody to gluten. And so most people aren't going to get sick from that. It's not the enough level to get sick, but there is a higher risk of gluten there. And so having separate toasters is typically a recommendation that we make for most people.
I feel like you probably need to say that a little louder for the people in the back when it comes to, like, symptoms don't tell you how much you're reacting, because I'm guilty of that too. Like, when I travel internationally, like, sometimes I'll splurge on a food and eat it because it tastes good, and I don't find I react as much physically. I don't get the same symptoms from even flowers and stuff like that overseas compared to here.
Yeah.
But okay, it's a good reminder to like rein it in for all of
Yeah.
you listening who are in the same boat where you like to kind of once in a while splurge. Probably not the best idea.
I mean, there's plenty of people that are fully asymptomatic that we have worked with. And if they don't follow a gluten-free diet, your labs are not going to look great.
Right. And then the long term, tell us like what's the long term impact of that? Like these long term risks of celiac, which is why we care about staying away.
Yeah. So first, most of the issues that happen with celiac are due to nutrient deficiencies and the inflammation that occurs in the gut.
Okay.
And so common nutrient deficiencies, B12, iron, vitamin D, when those are depleted because they're not absorbed properly, we notice a lot of downstream effects, right? So that can be neurological issues from B12. It can be hormonal issues. It can be infertility is really common, right? Celiac doesn't cause infertility directly. It's the nutrient deficiencies that are caused by untreated celiac that can cause infertility. There's some research that cites that there is some cancers that are increased risk for people with celiac disease. But I always say that these risks are not for everybody with celiac. They're for people with celiac that don't follow a strict gluten-free diet. So if you are following a strict gluten-free diet, these risks diminish significantly, right? There are plenty of people, myself included, that have gone on to have healthy, beautiful pregnancies without fertility issues once they follow and manage a gluten-free diet, as an example.
That's a great reassurance.
We'll be right back with more. If you're already running Dutch tests in your practice or thinking about it, there's never been a better time to become an official Dutch provider. Why? Because we go beyond lab testing. Our provider community gets exclusive access to clinical education, in-depth report interpretation, training, monthly case reviews, and one-on-one clinical support. Whether you're just getting started or looking to sharpen your functional hormone expertise, we give you the tools to grow. Join thousands of providers already making a difference. Visit DutchTest.com today. Welcome back to the Dutch Podcast.
So you've talked about the damage in the gut, and I think, we think about that a lot because inflammation in the gut and damage to the villi and, the inflammation and intestinal permeability that can come up, which we call like leaky gut sometimes, these can really factor into the symptom pictures for patients, even when we talk about neurological impacts and neurological symptoms. Can you share a little bit about the connection there? And I know intestinal permeability can be an issue for people who don't have celiac, but is it a bigger issue for people who do?
Yeah, good point. I think it's important to have people understand that a lot of these issues happen in people without celiac, right? Hormonal issues, infertility happens in people without celiac, right? So just because there's infertility doesn't mean that that person has celiac, and just because somebody has celiac doesn't mean they're going to have infertility or hyperpermeability, leaky gut. With leaky gut, we have seen it more commonly in people with celiac, right? We're going to see more inflammation in the gut in general, right? Because celiac damages the small intestines, it creates more inflammation there, and other factors too, right? Stress is really important. Stress is a big factor for gut health, and we know that a lot of people with celiac disease have higher stress, especially around food, especially around eating, and so that impacts our gut health. Other factors like their food intake, we talked about food quality in a gluten-free diet, that can impact their gut health. And so there isn't research to say that people with celiac disease have a higher risk of leaky gut, right? I don't want to say that. I have seen in our clinic, there is a higher chance of people with celiac disease having leaky gut than the standard population, but not significantly, because many, many people have leaky gut as well.
Yeah, that's really fascinating. So when you are seeing that, I mean, obviously this can have an impact longer term, and we know that dysbiosis and digestive problems actually are a root cause for autoimmunity. So it seems like there's this vicious cat chasing its tail kind of mechanism happening there where, if you have this gut damage, you could be more predisposed to autoimmunity.
Yeah.
And when you have this celiac autoimmunity, it's making your gut even worse.
Yeah. Yeah, and that's the tricky part. I mean, we often see autoimmunity come in pairs. And so one of the mechanisms is through gut health, but with celiac, because it impacts your gut so specifically on a mechanistic level, that also kind of double increases, the risk of autoimmunity.
Do you see a lot of dysbiosis as well?
Yeah, definitely. Yeah, when people come to us with celiac, one thing that our clinic really specializes in is people that have celiac, they have gone gluten-free for at least 6 months, right? Often we'll see people years out and they're still having the same GI issues, if not
Mm.
worse than before they went gluten-free. And so oftentimes people will double down on the gluten-free diet. I need to be more gluten-free. I need gluten-free tampons. I need to burn my kitchen down. Like, you know what I mean? I can't eat out, all those types of things, right? And they still feel sick. And so we need to come in and say, well, we have to look somewhere else. And
Mm.
so we'll use additional testing, the Dutch test, the stool test, to figure out what is the root cause of this person's symptoms. And oftentimes it can be dysbiosis. So bacterial overgrowth, we'll see SIBO really often. And treating those things can be significant for people with celiac disease.
Yeah, I imagine. Because I mean, we know that microbes are so critical for even
Yeah.
just for food digestion and breakdown.
Hmm.
I mean, it's so, so important that they're in good shape and healthy and
Yeah.
happy. And they
Yeah.
don't survive well in an inflamed gut. A lot of times you
Mhm.
even see dysbiosis where there's a lack of organisms. You actually just don't have enough
Yep.
organisms to kind of protect your gut. And
Yeah.
that happens quite a lot in those states of chronic inflammation.
And it's tricky because those people that have dysbiosis, have bacterial overgrowth, have inflammation, anytime they eat something, they have a stomach ache. And so
Exactly.
in their mind, if they aren't thinking of dysbiosis and like gut inflammation, which most people aren't, they're thinking that I got glutened every time I ate.
Mm.
And so that's really tricky because now they want to be more strict, and they have a bad feedback loop of thinking that they're constantly getting glutened when really gluten isn't the issue. Yes, you need to still be gluten free, but we have to address this other issue. And oftentimes with our clients, when we address things like, supporting their gut health, leaky gut, reducing their immune response, supporting bacterial overgrowth, they can now eat a regular gluten free diet fine, right? And not every single food causes issues, which gives them a lot more gluten free freedom, per se.
Yeah, it's interesting because I think I mean, any clinician who's worked with patients with gut issues, you really get a very strong sense of the level of distress
Yeah.
that you connect eating food, which should be a nourishing process,
Yeah.
with, because you're always afraid of the food causing you pain, causing you symptoms, causing you gas and bloating, whatever that symptom is. I mean, I know patients who had put themselves on such a restricted diet or just would like really hesitate to eat at all because they
Hmm.
just knew they were going to feel bad. And that, like you'd mentioned before, that perpetuates the cycle, both the story you have about the food, right?
Hmm.
About eating, but then also the stress and
Yeah.
the fact that your gut, you require parasympathetic nervous innervation for digestion to happen. Maybe you can talk a bit more about that because I think that's a really good shift into Dutch testing actually with cortisol, about just the importance of like what emotional state and physiological state we really need to be in to optimize digestion. And that's for everybody. But
Hmm.
if you have celiac or you have any kind of digestive challenges, it's even more so.
Yeah. Yeah. I love this topic. And I think we see it. Celiac is a really good example of this, but it can happen to anybody, right?
Yeah.
And so with oftentimes our clients with celiac disease, when they're newly diagnosed and they're figuring out this gluten thing, you go to a restaurant, you ask the right questions, right? And hopefully get a good gluten-free meal, right? You order enchiladas and you're like, I'm going to hope that this is celiac safe, but you're still really nervous, right? Because you don't know if you asked the right questions. You don't know if the chefs understood you. You don't know what they did in the back. You don't know what you don't know, right? And so you're really nervous eating this food. And maybe a family member made a funny comment to you, and that kind of made you extra stressed. And so now you're at this restaurant eating in a stressed state. Your body isn't in that parasympathetic rest and digest state. And so it's going to be harder for you to eat. And so you eat your meal, right? It's not digesting properly. You might start to feel a little bit unbloated, maybe some acid reflux if it's just kind of sitting there. And then after the meal, you start to feel it sitting there and you're like, well, that feels a little funny. I'm not used to that. Was I just glutened? And
Mm.
then back to that gut brain, connection. Was I just glutened? Was I sick? What questions did I miss? Ugh, how did I do this to myself? Oh, now my Uncle John was right. I'm going to get sick anyways. Where's the bathroom? Am I going to make it to the bathroom on time? Is this going to damage my lab results? All of those kind of things, the story you tell yourself, how you're interacting with your food, can be such a vicious cycle,
Mm.
and make things really challenging for people with celiac, that even if you're eating gluten-free meal, you're still going to get symptoms if you aren't in the right psychological state going into it.
I have to just point out, I love that you're saying, have I been glutened? Because I've never heard that before. You've like made it a verb. Like, have I
Oh, yeah.
been like have I been glutened? I love that and I'm taking it with me. That's really fun.
Yeah.
So when we talk about nutritional deficiencies, are there nutrients that you just are almost always replenishing in celiac patients? And how do you know when you can actually start that, when they're like ready to be absorbed?
Yeah. So I would say in celiacs and not celiacs, when we're looking at the gut health picture, oftentimes we're seeing iron deficiencies, vitamin D, and magnesium. So oftentimes we're supplementing with those. But we also want to get labs. So typically, if somebody comes to us newly diagnosed, or if they're having symptoms in line with nutrient deficiencies, we're going to get labs. Most commonly in a celiac picture, it's going to be iron, B12, and vitamin D, sometimes folate and some additional vitamins. But those are probably the most common ones that we'll see.
Okay. And the other one I want you to talk about is tryptophan. Like
Yeah.
tryptophan's interesting because tryptophan seems to come up a lot in the research as like a big piece of the mood puzzle for celiac patients. Can you talk a little bit about that in like a really simple explanation for us?
Yeah. So tryptophan is what helps us make serotonin, right? We all want serotonin. And so serotonin and tryptophan can be blocked when the intestines are damaged from celiac disease. And so one mechanism, there's a few, but to simplify it, one mechanism is if we can't absorb the serotonin and tryptophan properly, we're not going to get those happy mood boosting chemicals, which can cause some mood disorders in people with celiac disease.
Thank you for
Yeah.
clearing that up.
Yeah.
Now, I do want to shift and talk a little bit more about Dutch testing because I love that you're using Dutch testing where you think like, oh, celiac, we should be thinking about gut testing,
Yeah.
right? So I love that we're going to have the chance to talk a little about the role that Dutch testing plays in your practice.
Mhm.
And I think a lot of it starts with the fact that celiac is a physiological stressor for the body. And we talk about this a lot with patients and even with clinicians who are newer to looking at the HPA axis because when we think about stress, we naturally think about emotional stressors. And of course, with celiac, we talked about that. There's emotional stressors too. But sometimes when someone doesn't perceive themselves as being stressed in their day to day life, they have raging cortisol
Yeah.
that can be due to a physiological stressor. So, some of the ones that we talk about often are blood sugar dysregulation, chronic inflammation, pain or injury. We had this one report, just as a little side
Yeah.
interest, where we always look at the reports that are out that are like out of the norm. Our doctor team reviews them before we release them to doctors, to their our ordering clinicians. And there was this one where it looked like a contamination. The cortisol was like sky high, but the cortisone was also sky high, which usually with contamination you only see cortisol go up. And we're like, oh, this is so interesting. This really is this incredible elevation midday. And then so we ended up phoning the provider to try to say, can you try to find out from your patient what happened? This test is really unusual. Well, they broke their arm midday. They like had a bicycle accident, broke their arm, and then God bless them, they finished their Dutch test sample collection even after like leaving the ER with a cast. And that's what we saw. So
Wild.
like that physical injury, tissue injury, all of those things drive cortisol
Yeah.
just like emotional stress. Our body really can't tell the difference. So
Yep.
back to celiac, you have this like prolonged period of physiological stress over time. So I'd
Mhm.
love to know what you think about like when you should be ordering Dutch tests for patients with celiac. What are the first things that you look at?
Yeah. Good question. So I think kind of tying back to you can have celiac and something else, right?
Mm.
So when a client comes to us and they're following gluten-free diet and we do our due diligence, yes, John Smith, you're on a gluten-free diet and you're still having issues. We want to find the root cause. We want deeper. We want to get more data. And so the Dutch test is really the best way for us to get a good picture of their stress response from cortisol as well as their hormone needs. And cortisol is interesting because like you said, you can tell a patient, hey, I'm really seeing a lot of different increased stress responses here. And every time, I'm not stressed. I feel great, right? But having them understand, and the Dutch test is really helpful for this because I can show them paperwork and lab data to say, this shows your stress response.
Mm.
You might not feel it, but your body is feeling it, and your body is telling you that you are overstressed. And so that can be really, really helpful for clients to see the data, right? Because they think stress is just in their brain. And with celiac disease, it stresses out your body from nutrient depletion, from stress response, from eating challenges, a multitude of different things. So the Dutch test is helpful in the picture of somebody is a high stress state, and we want to be able to show that to them and get them some data that's really helpful to get their buy-in for treatment. And helping us paint a better picture when we suspect that hormones are in the picture.
I love that you talk about it as like a buy-in mechanism. I think that's
Hmm.
such a great descriptor. I mean, some people come into you saying, I'm so fatigued, I'm so overwhelmed, I'm anxious, I'm stressed, I like need some help with this. But there's a whole group of people that are doing a lot. I'm like, the arrows are like pointing to me with flashing lights right now. You do a lot, you carry a lot, you
Yeah.
feel resilient, you feel like you can handle it. And so maybe someone else with your load might feel stressed, but you're like, no, I've got this. Like, I've got
Yeah.
all the balls in the air. Everything's still floating. We're all good, right? So, but those people, we need to see it on paper
Hmm.
to make us say, like, oh, wait a second. Maybe I need to actually stop.
Yeah. Yeah. And so that buy-in, and typically, again, this is very stereotypical, but again, I'll put arrows at myself too. The people that are often have a bunch of balls in the air want data, right? They want to see
Yes.
something on paper. It's somewhat that same personality type in some instances. And so that's helpful to get that buy-in, whether it's from the cortisol picture or the hormone picture. It can be really helpful.
See, we like to have that, like we like to have the data because then we can outcompete ourselves to like show how we can
Yeah.
improve over time. It like it serves our little type A personalities, right?
Yeah.
Well,
And
I
I
want
think,
to talk a little
go
bit
ahead.
more about the HPA axis too. What do you typically see for cortisol on your celiac patients? Are there patterns that tend to come up more often?
I honestly wouldn't say there's a significant pattern related to celiac disease when it
Okay.
comes to the HPA cortisol. But I would say in our general client that we see, which is somebody that typically has a history of health issues, right? They come to us with really complex cases that doctors haven't been able to solve and to figure out. And they're typically in a higher stress state a lot of times because of the complex health issues, because of the weight that they carry from having to manage celiac disease and these other potentially autoimmune conditions. And so we see cortisol disruption at significant majority of the time. I would say at least 80% of the time. And so that's one of the major things that we work on with clients and help educate clients on of how we can reduce cortisol. Obviously, there's supplements that are helpful, but just lifestyle things, right? And it's different for each person in terms of what could be contributing to their cortisol dysregulation.
Mm.
But even things like, what is your sleep hygiene, right? Are you a busy mom that's like puts the kids to bed and now you're just scrolling at night for a few hours because that's relaxing to you? But maybe that isn't helping, your cortisol and your sleep patterns and that type of stuff. And so we really focus on the lifestyle piece as well, so that the person can carry those habits with them way beyond, our support.
I mean, that sounds like it's so important. It's more
Yeah.
than just food that you put in your body. There's all these behaviors that you need to put into place for really to support optimum healing.
Mm-hmm. Yeah.
Now, another element of the Dutch test I can imagine would be helpful when you're discerning the like celiac related symptoms from others is that we have a lot of neurotransmitter evaluation in our organic acids like HVA, VMA, kynurenate, quinolinate. Are those things that you look at as well, and do you see them change typically?
Yeah, I mean, the Dutch test is great because it shows us so many different markers that we can look at. And if we're going to
Mm.
order the Dutch test on somebody, it's because we suspect some underlying issue, right? This isn't just we throw it out for everybody with a celiac,
Right.
that we think that test is needed. But it can be helpful to show, and again, kind of like point to maybe a root cause of why there is mood disorders, why there could be related to fatigue, where there could be some dysregulation on that gut brain axis, and why it's also important that we're always tying gut health into things with hormones, right? With hormones, with neurotransmitters, and explaining that connection to the clients, because you and I talk about the gut brain axis second nature, but it's such a weird concept for people to
Yeah.
think of the gut and the brain being connected. I mean, if you told me that like my fingertips, my eyeball were connected, I'd be like, what? And so it's kind of communicating the same thing to the client of
You're
saying
right.
this lab results, on your lab test of showing your neurotransmitters is important. We need to address this. And it also relates to your gut and improving your gut health and improving your diet. And it's all really tied together.
Yeah, it's so interesting. I mean, we make so many neurotransmitters in our gut that a
Yeah.
lot of people say the gut's a second brain
Hmm.
in that way. And all those neurotransmitters don't make it to the brain to have activity the way the
Right.
ones that are made in the brain do. But there is obviously a huge connection with these neurotransmitters and gut health. And then
Hmm.
you look at now this new information on microbiota and their influence on mood and health. And I mean, there's just so much we don't know right
Yeah.
now. But a good guess is make sure you have good digestion. Just a
Hmm.
good foundational guess
Yeah.
to be really working on that.
Yeah.
Well, I want to talk a little bit more about how you're managing and helping people. I'm sure that's why everyone's listening. They want to know, like,
Mhm.
okay, this is all great, but what can I actually do about it? So, the gluten free diet is obviously the foundation of the care that you're providing.
Yeah.
But when you have patients who have symptoms like maybe anxiety and depression that are persistent, even when they're gluten free, and you know there's inflammation and chronic stress physiology going on, really you need to do more than just diet alone. You need that nutrient rehabilitation, nervous system rehabilitation, sleep rehabilitation. So where do you start with most patients?
Yeah. Yeah, so with anxiety and depression, which is pretty common in the general population, also with celiac, we always want to tie in other providers, therapists that can be helpful as well. Obviously, diet is important, nutrients is important. But I think when it comes to celiac specifically, one thing that we do differently is as providers that have celiac, we understand the emotional component.
Mm.
And celiac itself can be very, very isolating. And the patients and the clients that come work with us, oftentimes that are the sickest, are not the sickest physically. That part's easy, right? We can fix you physically. It's the emotional and the mental part that is really challenging. When somebody is really isolated because they don't ever eat out, right? They don't ever
Mm.
go to friends' events. They don't want to do potlucks. They don't have people in their own home. They're nervous every time they eat. It celiac can take over somebody's entire life. And so when that happens, that can be a big contributing factor to anxiety and depression, right? Anxiety around food, anxiety around people, anxiety around those conversations. And so really supporting our clients in that and helping them understand what is a risk and what isn't, right? Can you go to somebody else's house and use their kitchen supplies? Yes, just make sure it's washed, right? But for them, they need to have the confidence that someone they're getting the information from is educated and trained
Mm.
and they can trust. And so that's really what we bring to our clients. So when we're seeing those type of mood disorders, helping the client understand how they can integrate celiac into their life without letting it take over their full life. Because when it comes so overwhelming, so encompassing, so isolating, we can see a lot of mood disorders caused really by celiac disease.
That's such an interesting point. So, just to kind of rephrase, make sure I've got
Yeah,
it, what you're seeing is almost a secondary mood disorder, not because of the biology of celiac, but because of the social impact of celiac.
correct. Yeah.
Yeah, that's wild to really think about the layers of
Mm-hmm.
this, but it absolutely seems like that really important cause and effect that you're doing true preventive medicine by really helping people figure out how they can maintain the connections with people that leave them in good health.
Yeah. And I mean, if somebody has anxiety around eating and being social, yeah, they could take medication for it. Yeah, we can help their gut health to, improve it. But if they don't have the skills to go out to a restaurant and order food, they're still going to be stuck isolated. So
Mm.
we need to give them the skills and the encouragement to go out to a restaurant and order food, and almost like exposure therapy in some instances.
Yeah. Now, the other piece that you've talked about is that nervous system regulation. And we talk about that a lot, but like how do you bring that into a conversation with a celiac patient when maybe they don't have this bent? I mean, I think about the people who come to see a naturopathic doctor, they know what they're going to get, but with you with your dietitian background, nutrition background, you're probably getting more diversity. How do you bring this in and start the conversation rolling with those patients that maybe haven't thought about this before?
Yeah. We see this a lot. We see this when a client comes to us with gut health and they're like, I have celiac disease and bloating. Help me with my bloating from celiac. And we have to have the conversation of actually, it really sounds like this bloating is more hormonal focused,
Mhm.
right? Or actually, it seems like this is more a stress response, or, this is a nervous system dysregulation thing. And so it's pretty common. And I think it involves multiple conversations. It's rare that you're going to tell a client once, hey, I think your stress response is dysregulated. Hey, I think nervous system is an important factor. Let's try meditating. And then they're just going to now be a meditation genie, right? It takes a lot of education and resources and figuring out for the specific client what tools, what resources work for them while it's clicking in their brain that that's a factor and until it clicks, because sometimes the client needs to take the leap of faith and trust us, which takes time to build trust with our clients, to understand that the nervous system regulation is a big piece of it. Same thing with the gut health is a big piece of it. Hormones is a big piece of it. Thyroid can be a piece of it. It isn't always just my gluten-free diet is going to fix everything.
Yeah, I think that's really, really important to be thinking about. When it comes to eating, do you incorporate any kind of tips around eating as well to like serve that nervous system dysregulation?
A lot of, especially with our gut health, clients that really struggle with poor gut health is the rest and digest mindset, right? We're not eating in a quick state. We're not eating in front of the TV or in front of our phone. We're really chewing our food well. Putting them in a parasympathetic state can be really helpful to support the nervous system. And then we can do other things outside of the eating window in terms of getting outside of the morning sunshine, taking a walk, doing other things to kind of support nervous system, minerals and that type of stuff too.
It's cool. I mean, I think there's so much you can do like at the table.
Yeah.
One, I love that suggestion of like, don't be doing other things. I used to tell my patients, like, eating is the activity. It's the prize. Like, it is the only thing you should be doing. Not, I'm eating and. If you're adding an and, you need to stop that thing and like just eat. This is, you guys can't listen, but this is me saying this, but I was like shoving my face with lunch while Erin was like, rejiggering her camera. So we don't always get it perfect, but we have to try our best whenever we can. So, but we do our best at that. And the other thing that I'd always loved doing is having people just take like breaths, like breathe between your food, take a bite, chew it until it's like a, liquidy mush consistency. Don't swallow your food whole, which actually helps digestion. It makes it way easier. People forget the mouth is the start of the gut. And then I think just like pausing and taking a deep breath before your next meal, like next bite, I just think those really simple tips. Yeah. When you start to do them and you realize how hard it is, then you realize how much you are not following those things when you're trying to eat. Most of us eat in a rush.
Especially when you tell people, hey, make sure you're chewing your food. No one thinks they don't chew their food.
Right.
Everybody
we're like, I chew my food.
They chew their food.
But you don't.
But they don't.
No, you don't. And until you start to think about it, you're like, oh, wow, yeah. I really did. Like, I swallowed that lettuce whole or that whatever that is. Like, you only chew it enough to get it down, not enough that it's like a consistency that it should be.
Yeah.
But,
yeah. Especially when we get clients that, we talk about stool, undigested particles in their stool, right? Clearly you're not chewing your food, right? So last week we talked about you weren't chewing your food. And this week we've had this conversation about what's in your stool. And so chewing your food is going to be important, a goal for this time. So
I know. Thank goodness we're a hormone podcast and not a stool podcast because we'll be talking about that stuff all the time. But you're totally right. If you see corn or tomatoes or if you can tell what you ate, based upon looking at your stool, you got to start at the beginning. You got to chew your food because you should have taken care of that when it was under your control. Absolutely.
Yep.
I love that suggestion. So, I mean, this has been awesome. I've learned a lot and really gained from speaking with you. I know we have a lot of providers and a lot of patients listening. So I want to start by what you would say to a listener today who was maybe diagnosed with celiac disease. They are through that initial phase. They feel like they're doing everything right, but they're just not feeling like themselves. What would be your suggestions for them on what they should do next?
Yeah, good question. If for anybody with celiac, you've been gluten-free for 6 months, 3 to 6 months, and you are still not feeling well, whether symptoms changed, whether they're the same, whether they got worse, or whether they got a little bit better. If you are not feeling normal, you're not feeling well, it's time to look at something else. Go to a provider that understands gluten-free, that understands your celiac needs, so that they can treat you through a gluten-free lens, but that they can also look at other things with a really functional, holistic approach, that they can understand gut health and hormones and thyroid and other pieces that are an important equation to your health. And then for providers, on the same thing, if somebody comes to a celiac and they're still having gut issues, don't just assume it's because they're not properly following gluten-free diet. Right? Because they might be following a perfectly gluten-free diet and focusing too much on the gluten piece, you could miss an entire picture of what else is going on. And so I think that is kind of like my biggest recommendation for both providers of what we're looking at when managing somebody with celiac. And then for people with celiac is that you should, if you're following gluten-free diet, live a happy, healthy life with eating gluten-free and not having symptoms, right? Just because you have celiac disease doesn't mean you have to live a life with symptoms. You can be symptom-free. If you are not, you need to explore it further.
I love that. I mean, and we can't get you off the podcast without asking you one final question, which is, what are your favorite gluten-free splurges and foods? I mean, I think that was one thing that was actually super hard when you first get diagnosed is you want to try everything and you waste so much money on these like expensive foods that you try and you're like, oh my gosh, I can't even possibly eat these crackers.
Yeah.
So what are your favorite gluten-free go-tos that are your bread and butter every day? And then maybe like on that processed made treat kind of side, what do you go to?
Yeah. Every day, I really love a good bread from a local bakery. I don't have a specific local bakery in mind, but I do find that local bakeries have better gluten-free bread products than a lot of the big box names. So anytime I get to a local bakery, that's always like a good splurge. Um, Capello's also makes the best biscuits. So those are one of my favorites. Pasta. Nowadays, pasta is pretty good. I've been gluten-free for over a decade. And so honestly, I'm just amazed every time I eat a gluten-free product. How partially my tastes have changed. I haven't had regular gluten in, many years, but all the products now compared to how they were 10 to 15 years ago
They're
are
so much better.
so much better.
Do you
So
remember how it would
honestly,
just be like this gummy pile of like sticky rice
yes.
nastiness? They're
Yeah.
so much better.
They're so much better. Like that you can basically make anything gluten-free now, which I'm grateful for every day. So yeah,
I
I have no
actually,
complaints.
when I make gluten-free pasta, I'll be like, "Gosh, this is so good! You can't even tell the difference." And my kids are like, "Yeah, you can."
I know. For me, I'm
Right?
like my taste buds change, the products change. I don't know, but I'm happy with it.
Right. They don't complain. They still eat it. So that's good.
Yeah.
Yeah. The breads, I'm in New England and there's a bakery in New Hampshire called Abigail's. I'll do like a little shout out to them because they make a
Yeah.
millet and sweet brown rice bread that is the best texture. It's so good. And they even make a cinnamon roll, like a cinnamon swirl bread like that. It is so good. They are very yummy. But I completely second that if you can find a local bakery that's gluten free. Seattle had some great bakeries too.
Yes. Yeah.
When I lived out there that were gluten free, that were amazing.
Yeah.
Well, I really appreciate you coming on today to share with us all that you've learned. And I mean, those takeaways I think are so important of, managing the celiac, but also thinking outside the box because it's not always just celiac and you have to be able to look elsewhere if you're not getting where you think you need to as a patient or as a provider with your patients and clients. So, Erin, thank you so much for joining me. It's been awesome to have you on today.
Thank you all so much.
If people want to learn more about you, about your practice, follow you online, what are the best ways for them to connect with you?
Yeah, you can always find us on all platforms at the Celiac Space. And so you can connect through us through DMs or through our website as well.
Awesome. Well, thank you so much. And thank you to all of you who are listening today. I hope you found this conversation as fantastic as I did. I want to remind you, if you like content like this, you want to learn more about health, you want to learn more about hormones, we release a new podcast every Tuesday. So you can follow us at Judge Test on all the socials and be sure to click subscribe wherever you're listening today so you can catch us every time. We'll see you next week.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, be sure to like, follow, and subscribe wherever you get your podcasts.